lots of myths associated with epilepsy. It's a very frightening event to witness, and sometimes people think that Duppy has possessed you, or you're possessed with spirit or obeah. That's one big myth that we need to work to dispel. Another myth is that epilepsy is a type of madness. It is not a type of madness, it is a disorder of the brain. Just like asthma is a disorder of the lungs and the respiratory system, epilepsy is a disorder of the brain. And also, other myths that are out there is that epilepsy can be contagious, that you can catch it just like you can catch the flu or the common cold. This is absolutely not so. You can't sit beside somebody who has epilepsy or has a seizure and catch the disorder. And I'd mentioned in the treatment that sometimes we think that the patient may swallow their tongue when they're having a generalized tonic-clonic seizure, but this is not possible, and so we don't need to put anything in the patient's mouth to hold the tongue down. Well, NHF helps by decreasing the cost of the medication. Some of these medications can be quite expensive, especially the newer type medication. And epilepsy is one of the chronic disorders. So you're usually on medication on a daily basis, and sometimes lifelong. You have to take your medication daily, and sometimes twice per day. And the NHF does decrease the cost of the medication to the patient, and this is important in order for the patient to be compliant and stay on their medication.